Hi, my name is Whitney Miller, and I work for the Whiteside County Health Department in Rock Falls, Illinois. I'm a licensed clinical social worker, and I have been employed by the Whiteside County Health Department for almost 7 years now. I am currently the medication assisted treatment coordinator for those struggling with opioid dependence and alcohol dependence, and previously had been the behavioral health coordinator and project lead on implementation of our Telepsychiatry project. The Whiteside County Community Health Clinic was established in 2006 in response to the lack of medical, dental, and behavioral health care services within our community. It is a federally funded clinic that provides services on a sliding fee scale, and no patient is ever denied services for any reason. Besides providing services to the self-pay patient, Whiteside County Community Health Clinic accepts children's health insurance programs, Medicaid, Medicare, and third-party insurance payments. Whiteside County Health Department, located in rural Rock Falls, Illinois, was established in 1966 and has developed into a full-service comprehensive agency employing 150 individuals. Not only do we provide traditional public health services such as immunizations, environmental, infectious disease, and maternal and child health, but we also provide primary and preventative medical, dental, and behavioral health services through our federally funded community health center. We also oversee the county's mandated animal control department. By 2018, the Whiteside County Community Health Clinic's behavioral health care team had grown to 11 therapists and one part-time psychiatrist in attempts to fulfill the ever-growing patient needs with specialized mental health care and medication management. Unfortunately, shortly after this, our psychiatrist announced his retirement, and our in-house staff was just not equipped to handle our complex patient needs. This forced our therapists to make external referrals, losing thousands of dollars from billable services to other providers. Whiteside County Community Health Clinic needed a new clinician quickly and effectively. We posted the job positioning for a psychiatrist, and unfortunately, we had no applicants. Living in rural Midwest sometimes deters people from applying who are used to living in larger cities and highly populated areas. We had to start looking at alternative options at this time. That's when we found telehealth. Telehealth did seem scary to us, but we started our research and talking to several companies, we determined that Array would be the best company for us. Whiteside County Community Health Clinic is thrilled to be able to offer telepsychiatry services to our patients. Our patients no longer have to drive over an hour each way to get their mental health and medication management needs met. Having a psychiatrist who's so willing to work with our therapists and treat each individual holistically has been life-changing for our patients. Array is always so helpful and quick to respond with any questions or concerns that we have had. It has been a pleasure working together in order to serve those in need. It didn't take long for our patients to engage and feel comfortable in telepsychiatry with our Array provider, Dr. Epstein. The clinic was able to interview providers who fit what we were looking for, which was somebody with a good energy that was able to work in community mental health, that could engage our patients, who could onboard quickly, and had some flexibility for increasing hours later on. Whiteside County Community Health Clinic began by providing 12 hours of telepsychiatry each week, and we quickly realized that this was just not going to be enough. Our provider, however, Dr. Epstein, fulfilled her promise and was able to add on 4 other hours of telepsychiatry. So we currently have 16 hours a week of telepsychiatry, and in the future, we look forward to adding more hours to that. Although Array had made our transition to telepsychiatry fairly seamless, we still had a lot of things to figure out, like how telepsychiatry fit into our already developed workflow, what the staffing looked like, and how to make our patients feel comfortable with this transition to telepsychiatry. So we sat down, we developed a strategic plan, and we hired a registered nurse to work for the provider. We also developed a reminder call system in order to reduce no-show rates for the psychiatrist. And we wanted to be able to utilize her to the best of our capabilities the 2 days a week we were contracted to. We also had all of our staff in the behavioral health department meet with our new psychiatrist, Dr. Epstein, so that they could start to build rapport and in turn meet with their patients and make them comfortable with telepsychiatry. And we also developed patient education tools such as pamphlets, posters about telepsychiatry to prepare them for the transition. By using telepsychiatry, we have been able to increase our revenues, provide an essential service to our patients, and be able to allow our other medical providers to focus on their specialties without overwhelming them with other patients who are more appropriate to be seen by a psychiatrist. We were also able to reduce the amount of staff we would need with a psychiatrist because she is telehealth, which saves us money in the long term as well for staffing.